Infective endocarditis is a serious heart condition that can have life-threatening consequences if not treated promptly. It happens when the inner lining of the heart, known as the endocardium, gets infected by harmful microorganisms. The infection usually affects the heart valves, which are essential for regulating blood flow within the heart. Bacteria are the most common cause, entering the bloodstream and targeting the heart. Streptococci and staphylococci often originate from oral infections or skin wounds. These bacteria can enter the bloodstream through everyday activities, such as brushing teeth or minor skin cuts. When the infection reaches the heart, it can severely damage the valves, leading to complications such as heart failure or stroke. It requires prompt medical attention to prevent serious complications and improve the chances of recovery. Treatment usually involves strong antibiotics and sometimes surgery to repair or replace damaged heart valves. Early diagnosis and treatment are crucial for a better prognosis, and ongoing medical care is often needed to monitor recovery. Infective endocarditis can cause a range of symptoms, making it a challenging condition to diagnose early. These symptoms can vary significantly from person to person, often mimicking other illnesses. Fever is a common symptom of infective endocarditis, often accompanied by chills and night sweats. A heart murmur is another sign, which is an unusual sound heard through a stethoscope. This murmur results from turbulent blood flow within the heart, indicating potential valve damage. Small red or purple spots on the skin are another sign, often appearing on the arms, legs, or mucous membranes. These spots are called petechiae, and they are caused by bleeding from tiny blood vessels. Petechiae can be a critical indicator of underlying infection and should not be ignored. Patients might also experience fatigue and shortness of breath, which can significantly impact daily activities. Some people may develop swelling in the legs, ankles, or feet, often due to fluid retention or heart failure. Recognizing these signs early and seeking medical attention can lead to better outcomes and prevent complications. Rheumatic fever is an inflammatory disease that primarily affects children and young adults. It is a serious condition that can have lasting effects on various parts of the body. It can affect the heart, joints, skin, and brain. The disease often starts with a sore throat caused by streptococcal bacteria. This disease can develop after an untreated strep throat infection, which triggers an abnormal immune response. Rheumatic fever can cause long-term damage to the heart, leading to serious complications. It can affect all layers of the heart, including the myocardium, endocardium, and pericardium. The myocardium is the heart muscle, responsible for pumping blood throughout the body. Rheumatic fever can weaken this muscle, reducing its ability to function effectively. The endocardium is the inner lining of the heart, which plays a crucial role in maintaining heart health. Rheumatic fever can damage this lining and the heart valves, leading to conditions such as valve stenosis or regurgitation. The pericardium is the sac surrounding the heart, providing it with protection and support. Rheumatic fever can cause inflammation of the sac, a condition known as pericarditis, which can lead to chest pain and other complications. Nursing care is essential for patients with cardiac inflammatory disorders. These disorders include infective endocarditis and rheumatic fever. Nurses monitor patients' vital signs closely. These include temperature, heart rate, and blood pressure. Changes in vital signs can indicate a problem. Nurses also assess patients for complications. These complications can include heart failure and stroke. Nurses administer medications as prescribed. These include antibiotics and pain relievers. Patient education is another crucial aspect of nursing care. Nurses teach patients about their condition and treatment plan. Creating an effective nursing care plan for patients suffering from heart infections is paramount to ensuring comprehensive care and optimal patient outcomes. This chapter will cover the essential steps and considerations for developing such a plan. Firstly, it involves gathering detailed patient history and conducting thorough physical examinations. Nurses should pay special attention to signs of infection, such as fever, chills, and heart murmurs. Next, nurses identify specific nursing diagnoses related to the patient's condition. Common diagnoses may include risk for infection and decreased cardiac output. Moving on to nurses set achievable goals and outcomes. For instance, goals may include reducing fever, stabilizing vital signs, and preventing complications like heart failure. Nurses carry out the planned interventions. This includes administering prescribed medications, providing adequate rest, and ensuring proper nutrition. Patient education is also crucial here, helping patients understand their condition and the importance of adherence to their treatment plan. Finally, during the nurses assess the patient's progress towards the set goals. Adjustments to the care plan may be necessary based on the patient's response to treatment and any emerging needs. By following these structured steps, nurses can provide holistic and effective care to patients with heart infections, ultimately improving their health outcomes and quality of life.